Hello, my name is Dr. Bornali Bhattacharya. I'm a consultant pediatrician and the lungs of the asthmatic children who come to our clinic, they are the heart of our practice. The first Tuesday of the month of May is the World Asthma Day. Today is World Asthma Day. The theme this year is enough asthma deaths. Yes, asthma can kill. Globally, there are about 300 million asthmatics, of which 50% are children. 14% of the world's children have asthma. The prevalence of asthma in our country is not as high as many countries, but you will be amazed to know that 50% of the world's asthma deaths happens in India. And why does this happen? Because here asthma remains undiagnosed, untreated, incorrectly treated, as in patients just keep taking reliever nebulization and are not on controller treatment, or when they are on controller treatment, they are not giving it correctly or they are not giving it regularly. And also, when there are triggers that they can avoid, they still see that their asthmatics are exposed to that and they land up in flare ups. And a bad flare up can lead to fatality. So, how do we recognize that an asthmatic is having a flare up? It can be mild to severe because only if you know, then you know how to combat this. So, in a mild flare up, there will be a little breathlessness at rest. You can probably hear wheeze. You may or may not see the accessory muscles of respiration working. Those are the neck muscle, chest muscle, abdominal muscle. The child would be tired and not wanting to talk in sentences. With the increasing severity, the breathlessness might be more. Towards the end, you may not even hear any wheeze, but the person is gasping for breath. They would be bluish discoloration, wouldn't want to talk at all, or just in one or two words, and also confused or drowsy. Now, those are red flags. Those are sinister signs. So, what should you do when you see that the flare up is beginning? You remember one of my earlier talks when I spoke about the reliever and the controller medicines? If you haven't, please go back and see one of those talks of the various asthma medication. This is the time to use the reliever medication, which would be the blue or the green puff. Your doctor would have explained to you the asthma action plan as to how many puffs to give depending on the age of the asthmatic. So it could be anything between four, four puffs or six puffs. And when I say four puffs or six puffs, I do not mean squirting four puffs into the spacer. And remember, you have to use a spacer with the inhaler even for adult asthmatics. So if you're giving say six puffs, it's one puff given, wait for a minute, then you give another puff, wait for a minute. Within 12 puffs, if you're giving 6 or within 8 puffs, you would be seeing some response, as in the breathlessness is settling down. The person is more comfortable, is willing to talk more. But if all these things are increasing, breathlessness more, not wanting to talk, more confused, or getting bluish tinge, they need to be then taken to the hospital emergency. And please do not think that your nebulizer at home now is going to do the magic. Instead of the MDI, the inhaler and spacer, the inhaler and spacer is much better. I have spoken about this in one of my earlier talks too. In the hospital emergency, the doctors will use the nebulizer with oxygen. This is what this patient needs now. Suppose you see someone getting breathless in a public space. You must reach there and find out that are you an asthmatic? Are you carrying your reliever medication? Reassure them, let them sit up and take it. See if taking the reliever medication they settle down. If they do, well and good. If they don't, they need to be taken to the hospital. Each one of us should be knowing what to do as a first aid to prevent an asthma death. Yes, asthma kills. And if you are an asthmatic or your child has asthma, ensure that you're giving the controller treatment regularly as your doctor has advised, and you're giving the right technique. You're not getting carried away and not using the spacer. If you do all this correctly, the chances of flare up is much, much less. But sometimes we don't know that we may suddenly get exposed to triggers and might have a flare up. During this COVID 19 crisis, the air quality index is much better, so our asthmatics are doing well. That you now can find out what is the contribution of the pollution of the environment, particularly the vehicular pollution that can trigger off an asthma flare up. But the COVID crisis will settle down. We will flatten the curve. In time, we will have a vaccine, but the battle against asthma will continue. So please be part of this mission and prevent asthma death. That is the theme of this year's World Asthma Day, which is today, that enough asthma deaths. We don't want no more asthma deaths. Thank you so much for listening.